Welcome, dear viewers, to Health Television. Today, we are talking about medications and vital nutrients. And who my guest today is, you'll find out after the intro. So stay tuned. See you soon. Welcome back, and a warm welcome, dear Heinz Lüscher. You are the head of Weiss Medicine Clinic. I am very grateful that you're here today.
Gladly, anytime. These kinds of shows are fun.
For me too, especially since everything is once again made very easy to understand. It's a talent in itself to break things down so that even lay people like me can understand.
Yes, I also enjoy explaining medicine so that everyone understands.
Yes, I think everyone understands what is meant by medications. Many have already received them. But what are vital nutrients? Or what is meant by them?
Vital nutrients are essential substances from nature. These include the vitamins, the minerals, the trace elements, the amino acids, and the fatty acids. These are the essential vital nutrients we absolutely need. But then comes a whole class of secondary plant compounds that we also need for a healthy body.
But those would no longer be classified as vital nutrients.
Yes, but there are overlaps, of course, with nutritional therapy. You know, for example, that if you have stomach problems, you can drink chamomile tea. This has been known since grandmother's time, but back then they didn't know why. Today, these plants are so well researched that we know the molecules in them, that we can give names to these substances. Take grapeseed extract, or OPC, oligomeric proanthocyanidin. We know that this substance is in over 600 plants. It has anti-inflammatory functions in the body. So vital nutrient medicine or research has made enormous progress. Today, we have knowledge that we didn't have 20 years ago. But unfortunately, it has not yet penetrated medicine.
Could one argue that if one pays attention to these vital substances now, and really has enough of each vital substance, including secondary plant compounds, the medications might not need to be used at all?
Good thoughts. We could do without many medications. Probably not antibiotics, we need them. Even if you live completely healthily, you can have a bacterial infection. Tumors also rarely occur with a completely organic, physiological lifestyle. Rarely, but it can also happen. We can certainly avoid 60 to 70% of tumors, even with sufficient vital substances, but not all. There are simply diseases for which we don't know why they still occur.
Please excuse this brief interruption, but please subscribe to our YouTube channel below. This not only helps us to further spread this program, but also gives us the opportunity to bring more hope to many people. Thank you very much, and continue to enjoy the show. Goodbye.
And then there needed are the medications.
One can of course also be glad that antibiotics exist, or also medications.
You really have to look. What do you really need? We in integrative medicine are not against medications. We are for sensible use. And only what is absolutely necessary, not 7 more besides.
I believe that is precisely the great advantage of integrative medicine, that what is necessary or sensible is really applied.
During our studies, we once learned something about metabolism. But that's in the 2nd semester or so. You learn for a few months what happens inside a cell. After that, the clinical semesters come, and no one talks anymore about this metabolism. And for the rest of the medical career, it doesn't play a role anymore. To me, that's the tragedy of medicine. We have ignored the biology of humans. We are so focused on the medicinal treatment of diseases that we simply ignore the nature of humans. That must not be. For me today, when I consider what is the cause of disease, there is always some kind of defect in the metabolism. I have to find out what is missing in this metabolism that made the body sick. Then I try to replace these missing micronutrients. Then I have addressed the cause, the root of the disease, and not the symptoms. These are our basic considerations of our medicine. And unfortunately, when medicine jumps in and says it makes sense, we are still often challenged. I do not understand why.
Unfortunately, I do not understand that either. It is hopeful that it continues to spread. Such clinics like the Ruiz medicine, that more is offered there, so many people can benefit from it.
Yes, we have 2 clinics in Winterthur and Glogg, and we wish for many more. I am 75 years old and do not at all the sense of retiring soon. I would like to have at least 8 more in Switzerland. Gladly in Germany. It stands and falls with the doctors who think like that. Do you understand? A doctor who has no interest in integrative medicine does not help us. We need interested doctors. We are happy to train them. Doctors, choose yourselves. You are welcome to also open a clinic in Germany. We support that. But without a committed doctor who has a vision for biological medicine, it won't work.
Where is the interest supposed to come from if you haven't heard or been taught about it?
That's why I'm so glad for you that you broadcast programs on such topics.
Let's go back into the vitality stage. Has it changed over the years? If you take a look at the values of a patient's vitality stages,
measurements of vitality stages are not part of the standard program. When a patient comes, we look at the blood count, liver function, cholesterol, kidney function. You can measure all of that. But the micronutrients, how is the supply of selenium, of zinc, and specifically in the cells, not in the serum? Magnesium in the serum is still sometimes normal, even if you have too little. That doesn't tell me anything. I have to measure it in the cells. No one else does that. At the moment, we need special laboratories for that. We have one in Berlin that does these measurements for us. Measuring vitamins doesn't always make sense. Measuring vitamin C is pointless. It depends on whether you ate an apple or an orange beforehand. Then you have a higher level. That doesn't make sense. But the B vitamins, vitamin D, are deemed unnecessary and not covered by health insurance. Completely wrong. Vitamin D is essential for our health, for us to be well supplied. Those who actually do not supplement are too low. We can demonstrate this for every single person. Omega-3 levels can be measured. No one does it except integrative doctors. We are back again. We are starting in biology. Where deficiencies have a negative impact, we must begin. If we do that, we can save many medications.
Perhaps you've already mentioned the problem, that it isn't done at all, if we can save the medications. Let's tackle something positive about the matter. I am a young man and want to stay healthy, no matter how old I get. How or where can I have my vital nutrients measured? Would that make sense for my future health? What is my current condition? Where should it go? How can I ensure they remain good?
If you are completely healthy and exercise and everything is okay, then such measurements don't make too much sense. But now I may have said something again where others would intervene. Assume you are a top athlete. Then it makes sense again.
When the performance is higher.
If it's just about 1% performance, it decides over protest or not. Then it makes sense again. But these are measurements that are not part of the standard program. I have a sports program, also measurements with microsupplements in sports. In the Gold program, the most expensive, the patient pays 3,000 francs or euros themselves for measurements that are not otherwise done in conventional medicine. That is really comprehensive. This possibility exists. You have to consider whether it is worth it to you. Basically, with young, healthy people, I say you don't need it. But we also take care of athletes. We do it there.
That's good to know. Sure, if nothing is wrong, 3,000 is a very large sum. Would you also say, though, if I really pay attention to my diet, it is balanced, do I then get enough vital nutrients? Or are there still certain substances that I really need to take additionally, like vitamin D?
Yes. We know from such measurements, even with young, healthy athletes, that many micronutrients, especially the minerals, are too low. And indeed quite significantly in some cases. But you don't feel that. These are athletes who perform normally. They don't feel it. And if you top it up, that small difference could still be achieved. In every lab, there are normal values. From here to here is normal. If you're in there, everything's good. But I'm not so sure if these normal values are applicable to healthy people. I actually believe that's not true. Many normal values have come about based on the thousands of blood values we've seen, high and low. But these were all patients. We don't have any mass measurements of healthy individuals. And when we measure healthy people, the values are often higher.
I see the problem.
We started with the TAP device. This is a product where you can take your own blood. From your arm, we measure 30 parameters. You don't have to go to the doctor. You can order it. Everything is coded. Confidentiality is ensured. You can measure 30 micronutrients. About 20 of them are fatty acids, including vitamins A, E, and D, and a few trace elements. You can do this at home without a doctor's visit.
It's great. Especially for a doctor's visit, I have to take time off. Depending on the employer, discuss accordingly. I can do this at home on the sofa.
These 30 values, if you go to the doctor and have all this measured, at normal lab rates, you'll be about twice as expensive. The thing costs about 300 francs or euros. But really, you have 30 parameters, so really a fair value, with a description and explanation of what you are lacking and how you can replenish that.
This is the complete program, for that price.
Exactly. You can do that yourself. We also have therapists who recommend it. It's called TAP device, TAP.
Where can you get that?
At King Nature. You can order from kingnature.de.
I think it's great that you not only have the evaluation. If I have an evaluation about my blood, I don't even have to do it because I understand nothing. And you also do the... What does that mean now?
Yes, that's important. What good is it if I say your magnesium is 0.7 nanomole per liter? That doesn't tell you anything. The report mentions that your magnesium is significantly too low. We recommend a magnesium product, and so many milligrams. That's what comes out. This is a fantastic program being set up here. A whole database. I assume I have already seen that calcium is always higher than the normal values. Now we have looked at it with the lab technician. He consulted the literature. Now we have set the normal value a bit higher. It can't be that everyone has too much calcium. The normal values were wrong. We are learning.
These parameters must always be adjusted, depending on society. Healthy, sick. I don't know if even age still plays a role.
Yes, it does. Not for all, but for some parameters. In older age, significantly less vitamin D is produced than in young people. Then the values are even lower if you don't replace it. In people with darker skin, the values are also significantly lower than in heroes. These are things that need to be looked at.
I think this is a really exciting project. Without a doctor's visit. You never see a doctor. I get it by mail. I do it myself, send it back, and the results come back. If there is still something in these results that you don't understand, do you still have the option to call or visit somewhere?
Yes, of course. There are therapists, nutritionists, physiotherapists, and alternative practitioners who also offer that. The system is designed in such a way, with a password, that you can give it to your therapist. Then they have access to the program and can look at the values. This way, you can get advice.
Great.
If you do that, you send me your password via email, and then I see all your values. Then I can also choose who is finally willing to advise on all the values.
Great. What else is important to mention regarding vital substances that we haven't discussed yet?
We have already done shows about which medications can be replaced by vital substances, or which medications are marginally unnecessary. Shows of their own.
Are there also interactions between vital substances and medications?
That is rare. Vital substances are substances from nature. There are also no interactions between your lunch and medications.
That's true.
All vital substances we use are also on the plate. Just in different dosages, of course. But they are fundamentally materials from nature that have no side effects and also do not interact in that sense. These are exceptions. St. John's wort should not be taken together with other psychotropic drugs. These are really exceptions.
But actually, one can say that vital substances are the true natural medicine for humans.
That's how I see it. And all my biological colleagues, but further on, not the majority. We can do a lot. I would say 80% of all patients can be treated without medication. If someone has cancer, I'm certainly not against chemotherapy. Or for MS, I'm certainly not against biologics. That's logical. If a medication is helpful, then we're all for it. One must find the balance between both. Taking the best from both worlds. That's kind of our slogan.
Yes, great. If you want to delve a little deeper into this topic now, sure, you've already made several broadcasts about it. But are there other platforms or opportunities to engage further with this topic?
Well, I have my own channel on YouTube. Do you mean that? It's called Vitalstoffmedizin. I have 300 videos on there. For practically all important micronutrients, I make a short video. It's not like an interview. I mostly talk alone. But there are also interviews. And we also discuss the most important diseases in short videos. About the products for 3-4 minutes. And about diseases maybe 10. So deliberately kept short. The people on YouTube generally have an attention span of only 30 seconds. Yes. Yes. And there is plenty of literature. I can only recommend. Look around on the internet. Many of your professors who write interviews here have also written books. These are excellent works from which you can learn a lot. I also read them. That's what I learn from your interview guests. Among other things.
And they probably learn from you too. That brings us back to this integrative or completely medical medicine. Yes, great. Knowledge, ammunition to delve into is definitely available.
Yes.
Thank you very much for being here.
You're welcome.
And I would gladly see you again.
Yes.
And to you, dear viewers, I wish, of course, continued excellent health. And I look forward to having you join us again next time. Goodbye, everyone. Thank you for watching Swiss Health Television, QS24. Please don't forget to subscribe to the channel up here. Because here, you can also watch all broadcasts without ads. But subscribing to our YouTube channel also helps us a lot. Here is a selection of broadcasts compiled for you, which might also interest you. All the best until another time, and goodbye, everyone.